taking 3, 5, 7, or 12 supplements together without knowing how or why can have serious consequences, which ones? Reduced effectiveness, amplified side effects, or health risks? In today's video, I explain little-known interactions between common supplements so that you keep them in mind when planning your supplementation. First, creatine and caffeine. There's little need for descriptive effort with these two supplements. Creatine is probably the most consumed in the world of fitness, sports, and more recently, health. But caffeine surpasses it, being one of the most universally consumed substances in the world. So, the concurrency of the two is very frequent simply because of their prevalence of consumption. Is there a problem if I take caffeine and creatine together? That's what the authors of this review aim to discover. Some of the studies included indicated that chronic consumption of creatine and caffeine could reduce the ergogenic effect of creatine. In other words, caffeine would interfere, so to speak, with the performance benefits of creatine. And you might wonder why, Borja? Although it's not very clear, it seems that they have opposing effects on muscle relaxation. Both would favor gastrointestinal distress in the context of high-intensity exercise. And finally, one has a diuretic effect and the other, creatine, helps to retain intracellular water. This last point is important as the retention of intracellular water seems to improve the contractile mechanics of the muscle and be one of the mechanisms by which creatine has its effect. In any case, it seems that in some aspects the mechanism of action of creatine and caffeine are opposed, which is corroborated in this recent trial in which athletes of creatine and caffeine were administered to assess enhancements in cognitive and physical performance. After 7 days, those who co-ingested caffeine and creatine improved cognitive performance in the proposed tasks but not physical performance. The takeaway message is, if what you're looking for is maximum performance and you supplement with creatine chronically, don't take caffeine every day. Why? It appears there might be an interaction between prolonged caffeine use and creatine intake, although of course there is no unanimity in all studies. Calcium, a mineral particularly highlighted for postmenopausal women, and magnesium. Also in childbearing aged women at a lower area for any reason, or in people with intestinal absorption issues. What about magnesium? You have realized its importance and many of you have it as a daily supplement. It has helped you to rest better, to muscle recovery, or even to regulate blood pressure. In any case, what you need to know is that both compete for their intestinal absorption. This implies that increased calcium levels in the intestines reduce magnesium absorption. So, it seems reasonable not to take both supplements together. A 2-hour gap is sufficient to prevent this interaction. And note that there is a very interesting health relationship between both minerals, which we should ingest in a balanced way and in an approximate ratio of 2:1 for calcium and magnesium respectively. What this study tells us is that consuming a lot of magnesium when calcium intake is low is harmful to health, while the opposite, high calcium intake with low magnesium consumption, is also harmful. In fact, they postulate that the fact that calcium supplementation increases cardiovascular risk in some studies depends on a low intake of magnesium in that specific patient profile. In other words, there must be a certain balance in the intake of minerals, which is easy to achieve in an unprocessed diet but can become difficult when we deviate from that pattern, which is most common by the way. Zinc and copper. Something very similar happens with another well-known mineral duo, zinc and copper. Although copper is used less, zinc is one of the most used supplements with the purpose of supporting the immune system or the biosynthesis of testosterone, for example. Copper is an essential trace element and its severe deficiency can lead to anemia, leukopenia, and thrombocytopenia. Amazing that your body can't correctly produce the 3 types of blood cells: red, white, and platelets. This deficiency is incredibly rare. How does the interaction between the two develop? It's also a matter of absorption. Zinc, especially in high doses, inhibits the absorption of copper. And this leads to a problem called zinc-induced copper deficiency. How do you solve the problem? Well, by supplementing with both at the same time in adequate amounts, or by ensuring that zinc supplementation is temporary. That is, there's no problem with occasionally taking a zinc supplement for 1 or several weeks, as it won't have time to deplete the copper reserves. However, when supplementation becomes chronic for whatever reason, then this is something that needs to be taken into account. Vitamin K and anticoagulants. This is one of the drug supplement interactions that can have the greatest consequences for the health of patients. As you know, there are drugs called anticoagulants that oppose your body's natural processes to generate a cascade of coagulation proteins that can produce a thrombus. The most clear and direct risk and side effect of this group of drugs is very easy to understand: bleeding. If we overdose on anticoagulants, these patients can bleed easily. And you might ask, how do anticoagulants like acenocumarol or warfarin work? They're also known as antivitamin K, which is crucial. Why are they called that? You see, we need vitamin K to be able to clot the blood, and these drugs nullify the action of vitamin K, which is necessary to form some of the clotting factors. However, if we're unaware of this relationship and we consume these drugs along with high doses of vitamin K, believing it's vital for bone or heart health, the anticoagulant's effectiveness can be partially reduced. If these have been prescribed to you following deep vein thrombosis, a heart attack, or coagulopathy, you can guess it's not ideal for this to occur. Indeed, these patients' diet is regulated, limiting foods high in vitamin K. This is challenging as such foods are typically green leafy vegetables, which are restricted. Luckily, other more modern anticoagulants do not depend on the action of vitamin K and escape this problematic interaction. Iron is the most common deficiency globally, with calcium also being significant. On the other hand, both calcium salts and the calcium we find in dairy products reduce the absorption of non-heme iron, which we find in plant-based sources. This is problematic because both children and women of childbearing age are the most prone to iron deficiency, and at the same time those populations that we most bombard to increase calcium intake. The former due to growth, the latter for bone care, although this is more true in perimenopause. So what do I do if I have to take both? Separate them by a minimum of 2 hours. It's simple, don't take your iron supplement with meals, especially if they include dairy cereals, coffee or tea. In the end, as there are many different inhibitors of non-heme iron absorption, it's best to separate iron supplements from meals and take them on an empty stomach. Take iron on an empty stomach and high doses of vitamin D and calcium. Vitamin D and calcium, two micronutrients, are frequently consumed together for clear reasons. Vitamin D is necessary for the intestinal absorption of calcium, so a priori their co-ingestion would enhance their benefits on the bone. However, there are some recent studies that find a higher risk of cardiovascular events in those who supplement with both together, especially at high doses. Other studies have associated the intake of calcium and vitamin D with a higher risk of kidney stones, which generally, though not lethal, it's a painful issue that can degrade your life quality. This increase in cardiovascular risk that we're talking about is only found in some people and in some studies. So one has to ask, what determines whether a high intake of calcium and vitamin D is harmful or beneficial? Well, these authors suggest that it's about the magnesium status in your body. Higher magnesium usually means better cardiovascular health. This is apparent in most studies. The image shows that higher magnesium intake results in less arterial calcification. Interestingly, magnesium acts as a natural calcium channel blocker and hence its antihypertensive properties. What more and more authors affirm is that for calcium and vitamin D supplementation to have a beneficial and not harmful effect, we need a good magnesium status. This can be accomplished with magnesium-rich foods like veggies or supplements such as magnesium bisglycinate, which I've used for a while. As you may recall, the same occurred with magnesium and vitamin D. Taking high doses of vitamin D and also calcium in a context of low magnesium levels further decreases the concentration of magnesium within our cells because we need magnesium to metabolize and make use of vitamin D. Well, it seems that those low levels or that low consumption of magnesium would also have a negative modulating effect on the potential consequences of taking calcium and vitamin D. In conclusion, if supplementing with calcium and vitamin D, ensure adequate magnesium intake either through diet or supplements. As you can see, supplementing correctly is not as simple as watching a video and starting to take whatever you think. It requires some planning, knowledge of physiology, drug interactions, and above all, your specific clinical circumstances. Remember that you have the online consultation available if you need a more personalized approach. Thanks for watching the video till the end and for your subscription and support to the channel. Big hugs, see you next time, keep empowering.